If you want to know if BIPAP is an option for someone with a tracheostomy at home for hypercapnia, stay tuned. I've got news for you. Hi, my name is Patrik Hutzel from intensivecareathome.com, where we provide tailor-made solutions for long-term ventilated adults and children with tracheostomies. We also provide tailor-made solutions for hospitals and intensive care units, whilst providing quality care for long-term ventilated adults and children with tracheostomies, medically complex patients at home, including home TPN, home IV potassium infusions, home BIPAP, home CPAP, as well as home tracheostomy care for adults and children that are not ventilated. We also provide IV antibiotics at home. We provide services at home for port management, central line management, PICC line management, as well as Hickman's line management. We also provide services for palliative care at home. In essence, we're providing a genuine alternative for a long-term stay in intensive care and pediatric intensive care. We have also sent, and we are sending our critical care nurses into the home for emergency department bypass services. And we have done so for the Western Sydney local area health district, as well as some aged care facilities, to keep our clients out of ED and home. Now, today, I have a question from a reader who says, "Hi, Patrik. I have a family member at home with Duchenne Myopathy with tracheostomy on mechanical ventilation, mainly due to hypercapnia." Hypercapnia means high CO2 levels, high carbon dioxide levels. Is it possible to connect him to a BiPAP device, a home device, through the tracheostomy and decrease CO2 levels? Now, that's a great question. And this question has come from Cheryl Lee. Cheryl Lee, that's a great question. And the short answer to this is yes, you can do that, or you should be able to do that. I mean, you can't really do it without getting a medical order for it. But I've worked in critical care for nearly 25 years in 3 different countries, and I've worked with intensive care at home, obviously, for 15 years on and off. So from my extensive critical care nursing experience, absolutely, that should be an option. But you cannot do that without getting a respiratory physician or an ICU consultant look at that and make the order for it. You can't just do it without then checking CO2. You might need a sleep study for your family member. You might need some blood gases, or you can monitor the CO2 at home through a small connector and through your bedside monitor. So there are ways of managing that, but you can't really do it without medical order. But you also can't really do it without having intensive care nurses 24 hours a day. We have more and more families reaching out to us where we know they don't have the help they need, which is where this question is coming from. They're probably managing their loved ones at home. They don't know what they don't know. It is super, super risky. It is not evidence-based. And, I can already see from your message, your family member is at high risk of sustaining a brain injury, of going back to ICU if you're not managing CO2 correctly, But I want you to reach out to us. We're almost providing a helpline as well for families who have loved ones at home on ventilators or on tracheostomies, and they realize, oh, what we're doing is no longer working, and we are at risk of either going back to hospital all the time, or potentially even worse, our family member dying because we don't know what we're doing. Our staff that we have, maybe support workers, or general registered nurses without ICU experience, they don't really know what they're doing, because in order to answer questions like that, you need to have extensive intensive care nursing experience. Otherwise, you wouldn't even know what to look for. You wouldn't even know what questions to ask, and also what questions to answer confidently. What we do is evidence-based. When you look on our website, the mechanical home ventilation guidelines, they clearly suggest to have 24-hour intensive care nurses for someone at home on a ventilator with a tracheostomy, for someone at home with a tracheostomy without a ventilator, or for someone at home on BiPAP and CPAP ventilation without a tracheostomy, because that is an intensive care nursing skill. Anything less than that, your loved one is at risk of dying or going back to hospital. We know about at least 5 patients just in Australia alone that have died in the community because disability support workers, general registered nurses without ICU experience, or family members didn't know how to manage medical emergencies, didn't know how to manage a ventilator and a tracheostomy. The training that those people are getting from hospitals is substandard and cannot replace decades worth of intensive care experience. When you look at our team at Intensive Care at Home, we are employing hundreds of years of intensive care nursing experience combined. There's no other service in the country that sends such a highly skilled workforce like we are sending into the community. We're basically running an ICU in the community, but we can only do that because we have the skills, the know-how, and the intellectual property. Also, we have third-party accreditation for it. Other providers simply don't have that, So with Intensive Care at Home, at present, we are currently operating all around Australia, in all major capital cities, as well as in regional and rural areas. We are an NDIS-approved service provider. We are a TAC-approved service provider in Victoria, as well as WorkSafe in Victoria, iCare in New South Wales, and IISQ in Queensland. We are also a DVA-approved service provider all around Australia. We have also received funding through public hospitals, departments of health, as well as through private health funds. So please reach out to us if you need help. We're also providing level 2 and level 3 NDIS specialist support coordination if you need help with NDIS plan management, if you need help with increasing your funding, if you need help with just getting on the NDIS as an intake. We are also providing NDIS specialist nursing assessments if you need a nursing assessment. And if you are an NDIS support coordinator watching this and you are, or a case manager for other organizations, and you are looking for nursing care for your participants, for your clients, once again, you will be in very good hands. You can read up our testimonial section at intensivecareathome.com. We have been in business for over 10 years now. And like I said, we are the only service in Australia that is actually third-party accredited towards intensive care at home. Now, if you are a critical care nurse and you're looking for a career change, we want to hear from you. If you have worked in critical care and intensive care for a minimum of 2 years and you have completed ideally a postgraduate critical care nursing qualification, we want to hear from you. And if you think you can work in the community, it's a very different dynamic because it's really patient and family centered. I think that's really our point of difference. I believe that a lot of hospitals are not as patient and family centered as we are. Hence why patients are in a hospital, whereas, clients being at home is holistic, it's patient and family friendly. So, if you believe in that model of care, you will be in good hands with us. And we welcome you to reach out to us if you want a career change. We're currently having jobs in Sydney, Melbourne, Brisbane, in Albury, Wodonga, in Bendigo, in Country Victoria, as well as in Warragul, in Country Victoria. We want to hear from you. Please also know that if you are interested in working for us, we are not a nursing agency, but we are a service provider that has a tailor-made solution for our clients, which includes sending regular staff. That means our clients do not want people coming and going. They want regular staff. So, if you're looking for agency work where you can come and go, please, this is not for you. We are looking for regular staff. Also, if you're an intensive care specialist, an ICU consultant, we're currently expanding our medical team as well. We want to hear from you if you want to work with us. And if you're an intensive care specialist and ICU consultant in ICU and you have bed blocks, especially with long-term ventilated adults and children with tracheostomies or otherwise medically complex patients, including home TPN, we want to hear from you as well. We can help you eliminate your bed blocks and you won't even pay for it. And we improve the quality of life for your patients and your families. It's all about partnering with consumers. Now, and if you're watching this and if you're at home already, like I said in my question, really, and you're not getting the level of support you need and you realize that you need a lot higher level of support to avoid hospital readmissions and avoid your loved one dying, please reach out to us. Once again, we can help you increase your funding. We've done it many times for our clients and we can do the same for you. Finally, if you're a hospital executive watching this, we also want to hear from you because once again, we can help you eliminate your bed blocks in ICU and ED. We want to hear from you and you don't even pay for it using our service in most cases. And if you're in the US or in the UK and you need help, please reach out to us as well. We can help you privately. Now, once again, reach out to us at intensivecareathome.com. Call us on one of the numbers on the top of our website, or send us an email to info@intensivecareathome.com. And if you like my videos, subscribe to my YouTube channel for regular updates for families with intensive care at home and intensive care. Click the like button, click the notification bell, share the video with your friends and families, and comment below what you want to see next or what questions and insights you have. I also do a weekly YouTube live where I answer your questions live on the show, and you'll get notification for that if you're a subscriber of my YouTube channel, or if you are a subscriber to our email newsletter at intensivecareathome.com. Thank you so much for watching. This is Patrik Hutzel from intensivecareathome.com, and I will talk to you in a few days. Take care for now.